Hello everyone, we are group 7 and in this video we're going to present our human pathology case study. Ramtin and other members in the group are Yan, Jun Yuan, Sai Toong and Eugene. So starting with a quick description of the case study, our patient in question is a 64-year-old female. She came to the emergency room with symptoms including shortness of breath, being weak and also pale, and also she also reported that she had difficulty putting shoes on. Her medical history contains ischemic heart disease, multiple transient heart attacks, and she also reported that she did not smoke nor drink. And her family history includes her parents having lung cancer and colon cancer. So in order to diagnose her and come up with a treatment plan, multitude of diagnostic tests were prescribed, including the physical examination of her vital signs, chest X-ray, peripheral blood film, urinalysis, electrodiagram, colonoscopy, and a variety of blood tests, including general biochemistry, stool alcohol blood, complete blood count, electrolytes, arterial blood gases, cardiac enzymes, and tumor markers. While going through the results, I'm going to only focus on the tests that had abnormal results. So I'm not going to cover urinalysis, electrolytes, and cardiac enzymes as they all had normal results. So starting with her vital signs, the patient had a very high blood pressure, which is an indication of hypertension. She had a high respiration rate and high temperature, which she probably has a slight fever. Moving on to her biochemistry, the patient high calcium in her blood concentration, which is an indication of hypercalcemia, high BNP, which puts her in extreme likelihood of cardiac failure. Her high creatinine and blood urea nitrogen are signs that there are filtration issues in her kidney, and the low albumin is a sign of hypoalbuminemia. So moving on to the complete blood count, the concentration of the platelets, red blood cell, hemoglobin, HTT, MCV, MCH, and MCHC are low, and that combined with the erythrocytes that are found in the peripheral blood smear, we can conclude that the patient most likely has iron deficiency anemia. Moving on to the arterial blood gases, the patient has low blood pH and high partial pressure of carbon dioxide, which are both signs of respiratory acidosis. The low partial pressure of oxygen is a sign of hypoxemia, and the low blood oxygen saturation combined with the other arterial blood gas results are all indicative of acute respiratory failure. Moving on, the levels of carcinoembryonic agent CEA is higher than both the non-smoker and smoker ranges. So the other tests include the electrodiagram, which found sinus tachycardia and non-specific ST changes. This sinus tachycardia is most likely an effect of lung consolidation, which I'm going to cover later in the chest X-ray. And the ST changes are is very commonplace and not very significant in the later diagnosis. There was also blood found in the stool of the patient, and the colonoscopy revealed a polypoid ulcerated mass in the upper colon with a diameter of 3.5 centimeters. The histopathology of the polypoid mass revealed a numerous ulcerated cancerous cells in the colonic mucosa and submucosa region, which caused variations in the size and shape of the glands. The cells had enlarged hypochromatic nuclei and were highly proliferated in the sample. Here you can see the chest X-ray of the patient side by side with the chest X-ray of a normal lung. From this observation, we can say that there's a very high likelihood that the patient has widespread consolidation of the lung, which is a condition in which the normal air in the lung is replaced with something else. In this case, most likely fluids. So some signs include the heavy distribution of shadowing, in which the lower lobe shadows are denser than the upper ones. The non-uniformity of the border of the shadow and visible shadow threads of the airways are other signs of consolidation.
Thus, from both the analysis and interpretation of both the physical examination and biochemistry tests, we can deduce that the main diagnosis will be colorectal cancer, iron deficiency anemia, and pulmonary edema. The points supporting these diagnoses are as follows: colorectal cancer with the presence of an upper colon polypoid containing numerous ulcerated cells, pulmonary edema with visible consolidation, and iron deficiency anemia with the presence of erythrocytes. It can also be stated that the colorectal cancer is the main causation for these complications the patient is suffering from, as both the pulmonary edema and iron deficiency anemia can be linked to colorectal cancer itself. Aside from that, other site diagnosis and notable complications of the patient would be ischemic heart disease, acute kidney failure, pitting edema, and abnormalities such as organ displacement.
So colon carcinoma is a cancer that forms in epithelial tissue and it affects the colon and rectum. It also begins in the large intestine, which is the large section of the digestive tract. It's more frequent in older patients and it first appears in benign cells or polyps on the interior side of the colon. And the symptoms are weakness or fatigue, sudden weight loss, bleeding in stool, and abdominal discomfort. And there are three main pathways that lead to development, chromosomal instability or CIN, microsatellite instability or MSI, and CINP or aberrant DNA methylation. So given that it's present in 85% of adenoma carcinoma transition, CIN appears to be the most prevalent type of genetic instability in CRC. And CIN describes chromosomes that are added to or lost from the body at a high rate. So this results in a high frequency of loss of heterozygosity at the tumor suppressor gene loci. Um, and another form of genomic instability is MSI, which is a hallmark of cancerous cells that affects more than 95% of hereditary non-polyposis colorectal cancer and 15 to 20% of sporadic colorectal cancer. And patients with MSI phenotypes will often experience replication errors, and the microsatellite sequences will cause their alleles to either form longer or shorter. And now acknowledged as a key mechanism in human carcinogenesis, transcription inactivation by DNA hypermethylation at promoter CBG islands of tumor suppressor genes results in gene silencing. So the laboratory investigations that can be used to diagnose colonic carcinoma are diagnostic colonoscopy, which uses a thin, flexible tube with a camera at the end to examine the colon and the rectum. And if the doctor finds dangerous spots, they'll insert special instruments into the tube to remove them and take samples. Another one is blood tests. They're used to help determine presence of abnormalities in an individual's blood. They can also help monitor a patient's disease if they've already been diagnosed previously. And one type is known as CBC, or complete blood count, and it can be useful since it measures the different types of cells in the blood. And patients with colon cancer can become anemic since bleeding occurs from the tumor. And another type is tumor markers, which are produced by cancer cells. And then the most common way to monitor patients are by using tumor markers. And blood tests may indicate colon carcinoma, but it cannot screen or diagnose it. And the last thing is using gene samples. And if cancer is found, lab tests can be run on them so that the cancer can be identified. And if it's spread, doctors will look for specific genes that have changed in the cell. So then they can find treatments which are most effective. However, some targeted therapy drugs do not help with gene mutations in their tumors.
Right, the next diagnosis is iron deficiency anemia. It could be due to blood loss, lack of iron in diet, and inability to absorb sufficient iron. So in this case, blood loss from GI tract is the main cause as the patient is having colon cancer and regular heart disease. Dietary iron and recycled iron from erythrocytes are not enough to make for the blood loss when the body's iron reserve are reduced. Therefore, the blood often appears in stool or vomit, but isn't always visible, though it may cause the stool to look black or tarry. Dietary iron is essential for ensuring adequate iron availability for erythropoiesis. The ability of the guts to absorb iron is also important in avoiding or treating IDA. When the expression of the host hepcidin is high, dietary iron cannot be absorbed from the gut into the blood. Instead, iron will remain in the intestinal epithelial cell and escape into the lumen and feces.
The pathophysiology of the heart failure is a state in which the heart, through an abnormality of cardiac function, which fails to pump the blood at a rate of commensurate with the requirements of metabolizing tissue, or is able to do so only with the elevated diastolic filling pressure, which will then result in circulatory failure. Various non-cardiac conditions, example hypovolemic shock, can produce a circulatory failure in the presence of non-cardiac function. To maintain the pumping function of the heart, compensatory mechanism increase the blood volume, cardiac filling pressure, and heart rate. There's a progressive decline in the ability of the heart and contract and relax, resulting in the worsening the heart failure. The etiology of the heart failure can be classified into systolic dysfunction, which systolic dysfunction, the ejection fraction is usually less than 50%, result increase in the afterloop. Whereas diastolic dysfunction has unstable cardiac output, high filling pressure, and ventricular and resulting unstable heart rate and rhythm. Moving on to treatment options for heart failure and colon cancer. Drug treatment for heart failure that involves in symptom relief, example, the use of diuretics to reduce edema by reduction of blood volume, venous pressure, and salt restriction to reduce fluid retention. Secondly, SE inhibitors can use in regulate the effect of the heart failure, such as swelling, vasoconstriction, high blood pressure, and so on. Surgical treatment option would be needed for patients with severe cardiac failure, such as a ventricular assist device. If medical treatments are not helping, they should consider having a heart transplant surgery. With that being said, patient can live longer. Treatment options for colon cancer usually involve surgery to remove the cancer depending on which state of the cancer, such as radiation therapy and chemotherapy. Based on the case study, the patient's general health is poor and the cancer is most likely stage 2. The colon section may only require surgical remove partial colectomy along with any ejection lymph node followed by chemotherapy surgery to prevent the cancer reoccurrence. That's all from us. Hope you guys enjoyed our video. Thank you.